This definition of co-production is of co-creation rather, is something that Colin and I asked AI to produce for us. So it's all right as far as it goes, but it's a bit bland. And why it's bland is because it doesn't take account of the things that we have identified as being so relevant. There are many obstacles, many, Federico, I think call them pink elephants. Well, there's lots of pink elephants, pink, definitely pink, that we will be describing as we go through our presentation. But we like words in REN, we love words like collaborative process and so on. Diverse stakeholders, yeah, we'll have a bit of that. And yes, as it says, unlike traditional one-way models, yeah. So we know all that. And today, Colin and I are going to talk about the kind of challenges that REN is facing and trying to deal with at the moment. REN is the Whiteness and Race Equality Network. So I'd like to introduce Dr. Colin King, the founder of REN, and a great advocate for co-production. So Colin, over to you.
Yeah, thanks, Simon. I think the whole idea about us working together, that we realise that we operate in two cultural worlds that actually split geographically and conceptually. So I don't call myself a survivor or a lived experience. I think that's a misrepresentation of what I offer. I think I'm a consultant, an advisor, and a teacher. And we set up the network because we believed there was this almost apartheid system in knowledge formation and creation for change between disparate worlds. And those worlds start in the period of slavery, in the way the voices of Black people were detached and devoiced from having a legitimate co-creation vehicle. And that's what we're going to examine today. So that's me, Dr. Colin King. I'll pass you back to Simon.
Thank you, Colin. Well, and this is me. Rather nice shirt I'm wearing there. I'm not on my estate. I was at a friend's house in New York City. So this is me, and my work has been in community and further education over many, many years, as I said earlier. And the one thing that I've learned is to start where students are at. And in that way, well, I've been privileged to be part of processes where teaching and learning does actually become a two-way street. And that's certainly the privilege that I have of working for REN. So let's go on and look at REN's aims. So just to start off, and Colin will chip in a minute, our peers are the survivors of the mental health system. Our peers are also the people who work in NHS settings, the nurses, the doctors. They form part of our REN group. But our central concerns are with the survivors and their family and friends. And we examine issues around diagnosis from their perspective, and try to reflect and bring the lived experience of those survivors to the table. So Colin, can you chip in from there?
Yeah, and I think what we do, our mechanism is to reverse the power dynamics and to put the patient at the center of the knowledge foundation, rather than to use it as capital to justify pre-existing historical diagnostic frameworks that have been forced and criminalized people within the mental health system. So we don't see people as patients, we see them as the center of the creation, the co-creation, and what they bring is knowledge. Just like there isn't a test for schizophrenia, there isn't a test for bipolar, there's subjective constructions. And if that's the case, then lived experience has a vitally important role to develop a really important epistemological framework about methods, but also designing the outcomes that are beneficial for them.
Yeah, so it's a shared commitment to changing the narrative in terms of mental health provision. And in that, fundamental and at the heart of our work currently is the work we are doing with Ajibola Lewis, who Colin mentioned earlier on, the mother of Shani Lewis, who sadly and tragically died while a patient on a mental health unit. And through her activism and sheer grit and determination, the Mental Health Use of Forces Act was passed into legislation. I would say passed into legislation, but it's our task now to ensure that its tenets are being fully enforced. It's one thing to have something on paper, but is it working in action? So we're back with our Federica's pink elephants, because there are plenty of elephants in the room that block our way to the implementation of a law that should provide safety for everybody. So, Colin.
Yeah, and we think co-creation is a spiritual challenge. It's an intellectual and conceptual challenge. So it doesn't start with the structure dictating how we should work together. It starts about how we make sense of ourselves. That's why we used this person, W.D. Du Bois, who said back in 1903 that the major problem around co-creation in society was race. And it could be gender. We are on the national social panic now with Trump and Farage creating delusions about race. And this is a really serious implication for how we must need to work together in co-creation. We are so pleased to work with someone by the name of David, who works at the Mental Health Trust. And what we are trying to do is not getting just race is not just about the black experience, gender is not just about the women experiences, it's getting white and whiteness to think about how we work together, how we create divisions that stop us really creating creation. And that's why we look at Malcolm X. And Malcolm X said, we have to look at the relationship between the servant and the psychologist, the patient and those survive. It's an interrelationship. It's not a separation of voices. And we must spend a lot more time thinking about what we are when we make sense of race and its implications for people, practitioners, consultant psychiatrists, doctors, but also people who have actually, unfortunately, been diagnosed with schizophrenia, who have been in long-term wards and have lost their lives.
Thank you, Colin. And we can learn, as James Baldwin said, we can learn a lot from those who spent most of their life watching white people and outwitting them in order to survive. So we want to move from survival to aspiration. So as we look at this, Colin and David agreed that we need to work together. It's about coming together, from moving from co-creation to co-production, that we challenge white privilege, the big elephant in the room, the dominant factor we contest is in the way that psychiatry is delivered. Colin, do you want to say something now?
Yeah, I mean, one of the papers we wrote jointly with, I think Ashraf was involved in the paper, and Bill Fulford and Anne Buchrest, we were actually really interested in pre-production, which is the stage before we actually do the co-production. Pre-production is the historical stage where power values are reaffirmed to one particular group. And that actually shapes the ability to actually engage in real co-creation, because those power dynamics, those frameworks, those knowledge, those theories, those methodological frameworks are in place. So you're not actually doing co-production. We need to dismantle it, the pre-production stage, before we can engage this stage. And it means now white privileges, I'm not upsetting people, it's about white privileges is an important thing. It's what you do with it. It's like entitlement. What do you do with it? And that's what we're trying to say. We may need to give things up to really deal with political and economic co-production in mental health work. Simon.
Thank you. So it means facing up to and facing off with psychiatric approaches that are skewed to a white perspective. Do we dare to say, what's it like to be white? a question that often draws blank faces when asked. So we come together to try to recognise that there is moral evasion, as that's James Baldwin's words. There's moral evasion on the part of whites that reinforces white privilege. So, and also leads to this intrusive scrutiny of the black experience. What's it like to be black? What's it like for you? Without saying, what's it like for me from the white perspective? Colin?
No, this is something often where that I'm doing courses because I believe in the concept of Frantz Fanon. And we often ask psychiatrists, have you heard of Frantz Fanon? And they say no. I said, well, you're not trained to work in diversity. So I'm hearing voiceover somewhere. So, and why we think it's important that we come together is to develop in the loss of Sidney Fernandez, who was a very famous psychologist and psychiatrist, transcultural approaches, which is the theoretical foundation and bedrock to co-production. And that's why we think it's really important that the National Service, the police, you can address inequalities, but are you addressing the seeds of the inequalities, the foundation, the practice, the co-creation that really leads to inclusive changes? And scrutiny. Scrutiny is very important, and the last speaker did it very well. How do we scrutinize these processes?
So it's important for us to work with the groups that are trying to work with the institutions of the states, the community groups and the individuals like Ajibola, who are standing up and representing the needs of the community. But in all of this, there's always a danger of history repeating itself. And that's what we look at here. And unfortunately, we find ourselves having to refer back to the past because we believe that there are ghosts that stalk psychiatric corridors. And unfortunately, psychiatry is still haunted by voices like Samuel Cartwright. Colin, do you want to say something about drapetomania?
Yeah, we believe that to challenge the past is to challenge the founding fathers of philosophy, psychiatry, and medical practice. And it's also to challenge some of the ideological misconstructions that are still reality based in the way mental health is carried out that demonize patients, particularly black people. And one of the first diagnoses of black people was a person by the Cartwright, was named deptomania. And does anybody know about the Mental Health Act? It's very similar to Community Treatment Order, Section 17A, that if you run away, in this case slavery would be your slave master, but in terms of a medical profession, as you're a responsible medical officer, you could be brought back, because they was really concerned that slaves had a disease of the mind and the body. This is actually punctuated in early psychology and philosophy, if you read the books of Jung and Freud, etc. And so the logic is alive in the 60s and 70s. And it's alive in this diagnosis called schizophrenia, which I have and have had since 17 years of age, which means I am actually predetermined as a mental disorder before I enter the room. But the notion we challenge is a disease of the mind is about the failure of co-production with practitioners and patients. And that's why it leads to these devastating outcomes. In the 60s, it was a black disease. Huge number of black political celebrities were convicted. Now we have a situation in 2025, someone like me is 11 times more likely to be diagnosed, but a white person is more likely to be given a personality disorder. This is a fundamental challenge to mental health practice and co-production that needs radical change.
And as you can see from the quote at the end of this slide, that the theory of drapetomania is still kicking about and is the basis of an article written just this year, in May, earlier this year, where you can see the distortion and the trauma that this hidden agenda leads to. So we want to stop the mental health production line. Colin, can we lead on this?
Yeah, so we believe that mental health that has its history or her story in DSM and ICD-10, and has its history in Greek philosophy and can go back as far as BC. It really hasn't stopped its production line, because some of the things it needs to do to not only stop the production line, produce a new type of production line, is to promote radical changes. And this is what we mean about having racialized communities, listening to their voices as legitimate theoretical constructs and methodological approaches that gives people equity. And that's enshrined in a number of policy changes. People may have not heard the thing called the Patient Care Race Equality Framework, the Advanced Choice Document, the nominated person. That gives us some sort of a legal rights and access to freedom. That lived experience, and I think we've got to reconstruct this word because it's really misunderstood in co-creation. We all have lived experience, but how do we acknowledge it as a framework in terms of assessment, treatment, and discharge? And the last speaker talked about evidence, which I think is so clever. What is considered as legitimate evidence? Who provides the evidence? Yeah. People with lived experience have no legitimacy or capital in power in how the evidence is heard, not just to change how their reality is defined, but how theories of race should be based upon what we hear in those co-creation voices. I was sections at 17. I was a practitioner. I wanted to take my life because I realized that I was sectioning so many people under the Mental Health Act who weren't actually mentally ill. And a high percentage of those were Black young men, and a high percentage were white working class men. And so I'm driven through a co-production process with Oxford University, or anybody there today, is to change this devastating implication that's riddled our life in mental health practice.
Thank you, Colin. So we've been trying to put co-creation into action, and we associate co-creation in this context with liberation. We've been working with the United Family and Friends campaign, a coalition of families who have suffered greatly, who've lost loved ones, in both in police custody and in mental health units. And we've already talked about our association with Ajibola Lewis, and because of her campaigning, she is now a voice that is regularly heard at high tables at the NHS, and she meets with the police. She is heroic in what she is doing, but it is a very lonely path she is asked to constantly present her grief in order to demand change that would impact on mental health units and on society more widely. So we aim to support Ajibola in her efforts to ensure that the legislation under the Mental Health Units Act, Use of Force Act, to ensure that that legislation is actually an active and tangible product that everybody can access. Most important. So I'm going on a bit. Colin, do you want to carry on?
I think you've said it almost with time, and we've got 3 slides in 3 minutes. So just to
3 slides, 3 minutes.
Yeah, I think we've got 3 minutes. I'm not quite sure. All I would say about Ajibola Lewis is that she has now created a methodological theory called Cenism, which is actually an additional to the Eurocentric approach, which is like an Afrocentric approach to mental health, which actually is denied, not heard, and really important in co-creation. And I'll discuss it in the next slide very quickly as we move towards the end of this, because what we have done in working with Lancet Psychiatry, Oxford University, is actually say to them, we want to collaborate with you and establish a program. What the program actually is about is training peer reviewers from racialized communities. and their job is to reverse the power dynamic. And their job is to actually look at documents, publication, researches as in terms of the impact analysis for the lived experiences on the ward or in the community. And it's actually to correct, rectify, and change how people think about research, also almost detached from the implications and outcomes of people with lived experience. This is an amazing critical examination of methods that should take us closer to the world and actually look at whether qualitative data is actually distance ourselves to the reality, which we use the notion of little wooden lips or cultural schizophrenia, which the researcher and the method and the publication is totally out of reality to the individuals trying to make sense of, because there is no real co-production in that process. And we want to make sure any paper that's produced, if it's not able to meet those foundations, and I think Ashraf has actually been really affirmative in this, setting standards of liberation as well, which are actually based upon this. In the last slide, I'll go through this very quickly, if that's okay with you, Simon.
Yeah, of course. Just to say that Colin and I have been producing teaching and learning materials to sort of crack open the peer review process and involve people with lived experience.
Yeah, great
Yeah.
point. And that model will be available at the end of this year for global communities across the world. And in that, the evidence, what we must all confront is, do we have to discredit the conceptual beliefs around mental health and race? And one of the biggest issues that is actually infesting our community, and it led to the death of George Floyd, and it led to the death of Ebola, is the notion of excited delirium, which is a diagnosis which is not in the diagnosis framework, that has been constructed by the police and has led to the overwhelming arrest of certain racialized communities as well. So the last statement at the end is actually saying to people, we need to work interchangeably. We need to work in multidisciplinary and integrated approaches, but they must be reflected in the world, the methods that we work, and that needs to be recognized across the World Organization. Sorry, Simon, if I'm taking over. I just realized we've got
That's fantastic, Colin.
The last one is a present to you all. Is that
first of all, let me just apologise to Franz Fannin. He's frowning a bit because I've spelled his name wrong and I haven't put the book title correctly. Oh, well, no, I did an R to white. So Franz Fannin's Black Skin and White Mask is one of his seminal works. Apologies, Franz. Sorry,
that's
Colin.
okay. That's supposed to be a test for the people in the room to see whether they're actually listening. There may be other spelling tests. We're going to make sure you are enlightened and informed and taking place. But we wanted to leave you with a dictionary of the other, the Afrocentric philosophers, theorists, consultant psychiatrists that we don't hear about, and they're not intrinsic in our training, our promotion, and our methodology. From Franz Fanon, what people have to wear masks to actually deflate how they want to see the world to be seen. The souls of the black folk, which is this thing around transcendentally how we operate in that co-production mechanism, raising above our bodies to see how we operate in that interaction with the other. And then the famous QUES, which is the theory of color, how color has become a dominant theory now, even globally, about how we make sense of the world. And the last two things is bell hooks, when we look at the interconnected, that it's not this is about race, it's interconnected issues around disability, sexuality, and all sorts of other class experiences. And lastly, we have to produce an integrated approach to methods that research accurately the types of outcomes that suit the experiences of people with lived experience. Thank you for listening.
Yeah, thanks very much, everybody.
Thank you.